and welcome to everyone joining. I'm going to go ahead and pass things off to my colleague, Christy Scott. Christy, welcome.
Great, thank you. Good morning, good afternoon. I see lots of friends from all different places, from Uganda to Tanzania to Rwanda to the UK and here in the US. So welcome to this webinar, and we are certainly glad to have you here with us today to talk about community resilience, to better understand how to build individual and community resilience that supports youth. I am Christy Scott. I am the project director for YP2LE, Youth Power 2 Learning and Evaluation with Making Sense. We're super excited to have this webinar and to be able to present to you today. So with that, I'm not going to hold us up too much longer. Please keep introducing yourselves in the chat. We'll have lots of different opportunities for discussion as the presentation goes forward. And I'm going to hand it over to my colleague, Chelsea Palatino, to take us through this webinar. So welcome everyone. Thank you again for joining. So great to see everyone here.
Thanks so much, Christy. And you can move on to the next slide. So thank you everybody for joining today. And again, welcome to our webinar. In terms of our agenda for today's event, we're going to start with a brief overview of our activity, after which Miranda Manzanares, our research project coordinator for the Global Social Development Innovation Center at University of North Carolina, Chapel Hill, and the School of Social Work will describe our activity methods, our findings, and examples of promising programs and practices. We're then going to facilitate a question and answer session with our research team who completed the systematic literature review and key informant interviews, which includes, along with Miranda, Gina Chawa, the Professor, Associate Dean for Global Engagement and Director of the Global Social Development Innovation Center at the University of North Carolina, Chapel Hill, as well as Rainier Massa, Associate Professor at the University of North Carolina, Chapel Hill School of Social Work, and Heather Marlow, our Senior Research Specialist at the International Center for Research on Women. And after this interactive activity, we're going to discuss next steps for this work stream and conclude our event. Just very briefly, our objectives for today's event for our webinar are to describe key learnings in community resilience programming to better understand how building community resilience can promote youth health outcomes and positive youth health decision-making behaviors, as well as share key takeaways and areas for future research and interventions based on our activity learnings. This will include how community resilience is defined and measured, successful programming examples, and approaches for mitigating the effects of shocks and stressors on youth health outcomes. This relates to our overall workstream objective, which focuses on community resilience and youth health outcomes, specifically to better understand how to build communities' resilience to enable them to support adolescents and youth in carrying out healthy behaviors and accessing health services. Our team is achieving this by conducting research on community-based approaches and programs in low and middle income countries that incorporate a health resilience focus, and determining the key components of successful interventions for low and middle income countries that support community resilience to promote health, specifically for youth. And with that, I'll now turn the presentation over to Miranda Manzanares, who's going to lead us through our activity methods.
Thank you, Chelsea, for the brief introduction to the background for this work. Before getting into the specifics of the activity, including our methods and findings, it's really important to contextualize this work by examining first why the focus on youth health and youth health outcomes, and the important intersections of youth health and community resilience. Next slide. To begin, youth are a growing population. For example, youth currently account for a third of the global population and are continuing to grow at large numbers over the next 3 decades, specifically in low and middle income countries alone. There's a projected 62% increase by 2050. Additionally, youth experience critical changes in their development and health trajectories during the period of adolescence and young adulthood. For example, data justifies the need to focus on addressing youth health in that over 70% of preventable adult deaths stem from behaviors that began in adolescence, and nearly half of all mental health disorders are evident by age 14. With these few points in mind, without intentional focus on the health and well-being of youth, we as a collective people would not be able to achieve the Sustainable Development Goals and USAID specific developmental objectives. Next slide. Regarding the intersection between youth health and community resilience, understanding youth through a person-in-environment perspective helps to reiterate the importance of community resilience by highlighting that youth are situated within larger interpersonal or familial, communal, and societal systems that require supportive relationships and environments at each level in effort to promote positive health outcomes and healthy transitions to adulthood. This becomes especially evident for youth in fragile environments who often experience challenges when managing their health because their health experiences are often compounded by shocks and stressors that further exacerbate their vulnerability and disproportionately lead to negative health outcomes. And even though we could draw upon individual resilience by recognizing that this often improves one's unique capacity to withstand shocks and stressors, a community of resilient members does not necessarily equate to a resilient community because it often ignores structural constraints. For example, if youth possess the full agency, the knowledge, and the ability to access health services, the youth themselves may be considered resilient. However, if no appropriate health services exist, then it cannot be said that the community is resilient. Therefore, community resilience programming becomes a pivotal pathway to improving youth health outcomes by building protective systems and enabling environments where youth can thrive and draw upon community support. Next slide. Given these unique interplays between individual resilience, community resilience, and youth health, we sought through a review of the available literature to better understand how to build individual and community resilience that supports youth ability to access health services, practice healthy behaviors, and improve health outcomes now and into adulthood. And when we say youth, we're using the context of youth ages 10 to 29 years old, which is USAID's definition. And specifically, as Chelsea had mentioned in her introduction, we explored how to define community resilience as it applies to youth health in programming and research, best practices for promoting community resilience, the extent to which shocks, stressors, and protective factors influence resilience and youth health behaviors, and how community resilience is being measured. Next slide. The activity included two main parts, a systematic literature review and key informant interviews. First, for the literature retrieval, appraisal, and synthesis process. It occurred across 26 databases and collections in 3 distinct phases from the period of June to September of last year. Phase 1 included identifying what goes into optimal community resilience and its connection to youth health outcomes. Phase 2 focused on identifying programs and their connections to individual youth health outcomes. And Phase 3 dove into exploring the measurement of community resilience. Across the 3 phases, 533 records were assessed for eligibility and 118 were included in the final report. We did have specific inclusion and exclusion criteria for our review, which is explicitly noted in the full report, but for the sake of time, I'll not be going into detail on this. As we move forward, however, please keep in mind that the findings of this report are limited by that criteria. We are fully aware that there may be more on this topic that fell outside of our criteria, specifically in other fields of study that are more advanced in the area of studying community resilience, or possibly that some of the work being done has not made its way to being publicly disseminated yet. Secondly, to further contextualize what we are learning from the literature and address emerging gaps, we conducted 16 key informant interviews, of which included 5 researchers and 11 program implementers between November and December of last year. These participants were identified in collaboration with the YP2LE learning team, and recommendations received from contacted individuals identified to possess substantive knowledge in the areas of community resilience and health. Next slide. Now to move us forward into reviewing the findings and presenting some emerging gaps and next steps. Next slide. To get us started, we examined by what was put forward in the literature how to define community resilience. specifically as it related to youth health. And our findings revealed that definitions of community resilience are in their infancy, spanning multiple sectors and fields of study, signifying that there's not yet universal agreement in understanding community resilience as it applies to youth health. Across definitions, however, there is a consensus that a reciprocal relationship between individual and community resilience is assumed, which further suggests that understanding youth within the context of their environments, as mentioned earlier, is important. This continues to be supported in the literature, which also revealed that the predominant theories, models, and approaches of community resilience are grounded in understanding and application of the socio-ecological theory. To move us forward in sharing our learnings, we applied the following definition to guide our understanding and interpretation of the findings. So the definition of community resilience that we're using in this project is that community resilience in health is a complex process of converging physical, sociocultural, and economic environments. In turn, these environments create and enable individual, family, and community resources in pursuit of well-being and survival, both in the context of chronic and acute events or adversities. Lots to unpack there. Next slide. Our review activities included exploration of shocks and stressors that exacerbate negative youth health outcomes and health-seeking behaviors. Our findings specifically revealed that when looking at youth within the context of their environment, shocks and stressors are evident across interpersonal or micro, community or meso, and societal or macro levels, as depicted in the table on the slide here. Of course, there are some shocks and stressors of which you may be familiar with that are not necessarily depicted in this list, some of which include food insecurity, poverty, social exclusion. But it's important to keep in mind that the shocks and stressors presented here are not exhaustive, but rather those that were evident in the literature we reviewed. So for example, at the interpersonal level, some of the shocks and stressors that came up were looking at perverse social capital by youth and its unique effect on youth health outcomes being that there's increased youth involvement in violence and illegal activities. At the community level, looking at youth stigma resulting in exclusion, psychosocial issues, and internalized stigma among youth. And at the societal level, just picking out one, being youth exclusion, resulting in a decreased sense of shared cultural identity. So shocks and stressors do have a unique effect on youth health outcomes, some of which are depicted through those examples I just shared. And the shocks and stressors are considered unique to youth because youth themselves often experience these events differently because of the characteristics that they possess, including their age, their developmental status, individual capacities, and also the context of which they reside. Next slide. Likewise, we explored protective factors, or those characteristics and things that are considered supportive in building positive youth health outcomes and health-seeking behaviors. And our findings revealed that these as well can be identified across micro, macro, meso, and macro levels. And those that were observed in literature are depicted on this table as well. So looking specifically at protective factors at the individual level, having present protective, caring, and involved families, parental supervision, non-irritable parents, youth peer support. At the community level, looking at supportive, safe school climate, community leaders to advise, encourage, regulate, and formulate protective rules for youth, and even digital spaces such as social media groups for those youth who are traditionally marginalized or considered hidden. And at the society level, really involving youth in health policy programming and decision-making were all identified as protective factors. And these protective factors are largely dependent on the cultivation and development of positive relationships with peers, trusted adults, and caregivers, as well as supportive enabling environments along with the intentional practices, as I had mentioned, that prevent youth exclusion. Next slide. With regard to community resilience programming, our findings also revealed that a limited number of youth-specific and community resilience-focused programs that explicitly work towards mitigating the impact of shocks and stressors on youth health outcomes exist. Of the programs that we did review, they varied in rigor and quality, and few documented the impacts specifically on youth health outcomes or focused on the community itself. However, despite the limited number, our review did identify a few programs that are exemplary in promoting individual resilience, two of which are depicted here, but not necessarily community resilience. Across programs reviewed, a focus on mental health was also evident. And this is so because our findings noted that these programs tend to focus on individual youth resilience as a means of promoting community resilience, rather than focusing directly on community resilience and the environments in which youth live. And also, programs tend to conceptualize youth resilience as a psychological attribute. Our Family, Our Future was a resilience-oriented family intervention program targeting youth aged 13 to 15 and their caregivers or parents. It was the only program to describe impact, revealing that several protective behaviors increased post-intervention. Those protective behaviors being increased HIV testing, reduced inconsistent condom use, improved knowledge of HIV, risk perception, improved self-efficacy, lowered depressive symptoms among youth, and youth also had reported higher levels of resilience and positive family peer interactions. An additional program, Project Shine, was a sanitation, hygiene, and health promotion intervention, which revealed that there was increased positive health behaviors and promoted the individual knowledge and skills of youth that ultimately strengthened their community to be able to better promote public health through recognition of their role. So this further demonstrates that as youth develop skills, they often give back to their own communities, which results in collective community resilience. Next slide. A third exemplary program that we had found is more towards the macro level, looking at the example of a national strategy to address youth exclusion. And through this strategy, the goal is to create institutions that positively support youth and community members in planning and policy processes. And from this, it was found that there were increased inclusivity, community ownership and leadership, joint planning, implementation, and monitoring. There was better use of evidence sharing and sharing of promising local practices and flexibility as a result of this intervention to include youth in the planning phases. Next slide. Next, our review and key informant interviews explored what are the building blocks of resilience and resilience programming. Findings were consistent in that building blocks within the literature could be identified across micro, meso, and macro levels, as you see depicted on the slide. The micro level being those boxes in gray, so looking at resource access, local knowledge, and family peer relationships, all of which were also demonstrated in the previous programs that I had mentioned. The meso or the community level, looking at community preparedness, community resources, community networks, and relationships. And then at the macro level, looking at economic investment, health services, and governance and leadership as being building blocks of resilience. Additionally, those interviews with our key informants identified building blocks to include youth having a trusted adult relationship, the ability to trust community members, and the ability of the community to provide an enabling environment, so looking at those trustworthy systems. Having safe spaces, both physically and digitally, to share experiences, ideas, and feelings, and capitalizing on the assets and resources that are already embedded in communities and among community members through employing asset-based approaches. Next slide. Our key informant interviews also brought forth some key barriers to resilience and resilience programming, of which included those that the norms are not being challenged in communities, the focus on empowering individuals versus collective community empowerment, limited funding and short funding cycles, and minimally or not meaningfully engaging youth in programming. Next slide. And to sort of wrap up our findings in terms of looking at measurement, we did explore how community resilience is being measured, and our findings revealed that the measurement of community resilience varies in both type, being quantitative measures versus qualitative measures, the level of the indicator, so looking at individual level versus community level, and the reliability of the tool itself. A more specific review of the indicators of resilience being used in the literature that we reviewed showed that a majority of the focus was really on the individual level experiences, which aligns with our finding that studies of community resilience tend to focus on the individual and the contribution of individual resilience to community resilience rather than community resilience itself. However, the tools we were able to, of the tools that we were able to identify, 2 exemplary tools came about, which are the Child and Youth Resilience Measure and the Brazilian Youth Questionnaire. So the Child and Resilience Youth Measure was the most commonly cited tool, and it was used cross-culturally and multi-country across 6 low and middle income countries. It's often used in conjunction with additional tools to specifically measure youth health outcomes in connection to exploring community resilience. And it consists of a 10-item subscale on intra and interpersonal resilience, as well as a 7-item subscale on caregiver resilience. The second tool was related to the Brazilian Youth Questionnaire. And that tool was country specific, although it really explored ecological risks, looking at family, community, or college-related factors, and protective and promotive factors within positive youth development. Additionally, along with measurements, I did mention that there was the mention of quantitative and qualitative tools. Largely, our review had focused on quantitative, but photo voice and interviews with youth and involvement of youth was listed as a qualitative measure for really looking at community resilience as well. Although much of the work in this area is more exploratory rather than confirmatory. Next slide. So this really leads us to our emerging gaps and recommendations, which revealed the following. So from our review of the literature, emerging gaps sort of revealed that there's a lack of youth participation in community resilience programming, meaning that youth are not necessarily included in programming design and implementation in a meaningful way. Additionally, Western-based theoretical models and theory discourse sort of lead the path in community resilience as it relates to youth health, And most community resilience programming targets in-school adolescents, leaving those who are on the margins further excluded. And there's also a lack of focus on detrimental and cultural religious practices. So of these emerging gaps, some recommendations that we had put forth in our review included developing a theory of change to explain pathways for resilience, connecting community resilience with positive youth development programming, developing standardized measurement tools that specifically include community level indicators, and developing a blueprint for adapting practice models to local contexts. Next slide. I believe this now brings us, that was a lot of information and a lot to digest in a short amount of time. I encourage you to review the full report when it comes out to go more into detail. There'll be 3 resources, a brief a report specifically for practitioners, as well as the full report itself to go into more detail. And we're also available to answer more questions as we engage in the next steps of this activity. So I think we can move on to the Mentee Meter activity. So to get us started with this question and answer session, we really wanted to begin by asking you all a couple of questions in reaction to some of the findings that were just presented. The first beginning with, what are 3 words to describe community resilience? So looking at your reactions to the definition of community resilience that we had used in this report, as a reminder, I can paste the definition in the chat, which was that community resilience in health is a complex process of converging physical, sociocultural, and economic environments. In turn, these environments create and enable individual, family, and community resources in pursuit of well-being and survival, both in the context of chronic and acute events or adversities. So thinking about that definition, what are 3 words that you would use to describe community resilience? Wonderful. Yeah, contextual, collective, enabling environment. All right, seeing no more moving in, I think we can move forward to the next question. And I realize I got a little bit ahead of myself. So now thinking about your reactions to the definitions that was used. And as a reminder, that definition is included in the chat.
Cole, perhaps you can repaste the next question in the chat so everybody has it for guidance to respond and share their responses as well. And it looks like everybody should have access to the next Mentee Meter question. It has been updated, but also please feel free to share in the chat as well. Okay, so I see some responses in the chat. So I see from Franco, community resilience is the sustained ability of communities to withstand, adapt to, and recover from adversity. And he notes health, was referring to physical, behavioral, and social. Excellent. Also see some responses from Raymond. Community resilience is the individual and collective capacity to respond to adversity and change. Excellent. So really thinking about, as it relates to that social ecological model, those different levels and the interaction between those levels and that interdependence. And feel free to share also in the Mentee Meter. It looks like we have some responses populating. So another response about withstanding and adapting to adversity, adopting new techniques and ways of technology. So someone noted the references, how the definition references communities as a whole rather than the members of the community. Absolutely. So really, again, thinking about the collective impact of different individuals of the community and in that relationship. and some mention of the note about chronic and acute events. So, and absolutely considering an assets-based approach as we think about promoting positive youth development as well, instead of that deficits and needs-based approach as well. And please feel free to continue to respond in the chat, and again to the Mentee Meter. We see also another response about income generating activities for adolescents as a way of building economic resilience and preparing youth. And Stephen, thank you for mentioning the COVID-19 pandemic. So as we're thinking about building resilience, about the community and sort of the impact the community can have on collective well-being to promote resilience. Absolutely. Some additional responses about making this how the definition is very well-rounded and all-encompassing and comprehensive. Excellent. Really appreciate these thoughtful reactions, both supporting what our team has found, but also thinking about these additional considerations.
I will also move us forward to this next piece as I just get the next question up.
So the next question, as Miranda pulls up the next Mentee Meter slide, is, I'm actually gonna share my screen with you guys if you want to access it here, is based on your experience, what are your reactions to the findings presented on community resilience programming and measurement? So I went ahead and put up the code there, but the link is also in the chat while Miranda goes ahead and pulls up the next question for you.
Yeah, and as we're thinking about this, thinking specifically about the types of interventions or the tools that were presented and what might be missing, and if there are also just general reactions to some of the findings as well.
I see some initial reactions shared in the Mentee Meter, again, relating back to our consideration of those different levels of the social ecological model, that emphasis on individuals, without really thinking about those different levels that are really needed to support them and the enabling environment to improve youth health outcomes. So noting, some comments about the need for more evidence-informed programming, absolutely. And of course, the continuing need for youth engagement and programming, really thinking about the important contributions that youth can make as we're really thinking about the design of some of these programmings, as well as their implementation and analysis and evaluation. So again, also happy to hear from participants about other interventions, other tools as well. You can feel free to note that in the chat as you really thinking about the findings that our team shared today, and anything that based on your own experiences might be considered when we're really thinking about better understanding community resilience programming and measurement. So feel free to also note that in the chat. Appreciate again the note about really considering COVID-19, shared by Raymond, about improving knowledge as well. So thinking about also STI, so really considering sexual and reproductive health related outcomes and maybe some applications there as we continue to carry out this important work during the COVID-19 pandemic. I appreciate you sharing. You see a new comment about localization. Absolutely. So as we think about the renewed focus on localizing development, some great feedback as we really think about contextualizing our work also for different settings of programming. So noting anxiety and stress as well as different outcomes when we're thinking about measuring and understanding community resilience. Okay, so I think at this point we can probably, shift to this next question, see if there's anything else anybody has to share, and then we can also move to more open questions and answers, our question and answer and discussion section to see if there were particular follow-up questions you had for our team as well. But perhaps initially sharing any thoughts you have for our last question. Again, thinking about also your own needs as we think about furthering the evidence in community resilience programming and youth health outcomes. So feel free to share your contributions in the chat or in the Mentee Meter link as well. If there's no further questions or inputs, we can go to our Q&A session and see as well for any feedback you all might have on today's findings that have been shared. So perhaps we can. So now I'm going to open it up to our team. We have Miranda Manzanares, Gina Chawa, Rainier Massa, as well as Heather Marlow, our research team that carried out these activities. So now is really the time for you all participants to share any questions you might have based on the findings, and again, any resources you might want to note in terms of really better understanding community resilience programming. So I welcome you all to note in the chat or feel free to come off mute to share your feedback with the team. So I see a comment from Emily. How will these results be shared widely for non-technical audiences? So thinking about data visualization, one pager, or any other formats. So I can actually respond maybe to that comment, and also turn over the team to add anything else in addition. We will have 3 different deliverables, which I believe Miranda noted earlier. We have a report, which really comprehensively outlines the findings from the systematic literature review and key informant interviews. We also have a 10 to 15 roughly page practitioner guide that shares more practical programmatic applications and recommendations as a result of the team's research activities. And there'll also be a summary brief just highlighting some of those learnings. But I welcome the team to note any other thoughts or any notes that they want to share related to the work. Maybe the team can speak a little bit more about your recommendations based on your perspectives from carrying out this research activity, really revisiting some of these key takeaways that you shared and emerging gaps, maybe, some important key takeaways that you want to maybe expand upon in our time. So I'll turn over to the team to chime in.
Well, I can start. So I think since we are in the field of positive youth development, and we really would like to see youth participate in their own well-being interventions. I think one of the key takeaways was to see how that most of these interventions did not include youth. And so just to clarify, I see that there were some recommendations of how we should include economic strengthening activities, for example. I think that we need to reiterate that this was a systematic review of literature that is available. And so what we present is what we found in the literature. So the one thing in terms of recommendations would be to ensure that there's youth participation at all levels. Secondly, I think you rightly point out that most of these issues are resource-based. When we talk about health, it's about, do folks have access to resources? Do folks have access to services? Can they pay for those services in places where these attract costs? And so economic strengthening activities are important, not just for paying for health costs, but also food in the household and all that. So that was another takeaway. I think for us to really have evidence-based interventions, we have to have conceptual frameworks and theoretical foundations that are solid. And so to see that most of the literature was based on Western focused theories, that was a big takeaway. So the recommendation would be, can we begin to think about locally based theoretical frameworks, conceptual models where we really take into consideration what the context is and build from there, so that when we think about interventions, they are really built on context specific theories. I'll leave it at that. There are more, but those are the three that I can talk about. Maybe Heather and Rain and Miranda can pick it up from there.
Hi, everyone. I can go ahead. This is Heather Marlow from the National Center for Research on Women. Just to reiterate the importance of not just youth engagement, but meaningful youth engagement, not tokenistic youth engagement. Again, I think not only as part of program design, but also even research, and really building upon, I'm a researcher, so research methods that are participatory and youth-led, to help define, as Gina suggested, some of those locally based theoretical frameworks. And I think also as researchers, thinking more about how we measure not just individual youth resilience, because I think we often try to build youth capacity or empower youth, but then if they become trained or empowered, but have nowhere to then exercise those skills, that's a problem too, and points to the importance of resilience at the community level and resources at all levels that will then, feed back to enabling youth to exercise their new skills or their access to health services, for example, since we focused on health outcomes. And then I also wanted to point back to some of what our key informant interview respondents mentioned, as well as one trusted adult, especially for youth who have undergone trauma, and thinking about trauma-informed services and trauma-informed approaches for young people who have undergone traumatic events. It's key that they have some trusted adult to help to guide them through, the next steps in their lives. And then also those safe spaces and enabling environments. So what is surrounding the youth in terms of supports can really go very, very far in terms of what they're able to then exercise within their community. So I'll stop there, and it looks like we have a participant who'd like to speak.
So I do think when maybe in our remaining time, we have a few minutes left, we could take one more question. Maybe I can just synthesize some of what has come in the chat while we've been waiting and talking through some of these initial questions. So we had a note from Arthur about additional resources to support capacity building in communities. Also a note from Nalini from EDC about how you see community level organizations contributing to community resilience. And then, another question from Franco about opportunities you recommend in terms of targeting young people, particularly from at-risk populations. So I think a question on other considerations related to the community level and resources to support that capacity as well. So if there's any initial maybe brief responses to those questions from the team, and then we can, unfortunately we'll have to wrap up, but I welcome the team to chime in related to these additional questions that have come in.
I can take the second one by Nalini, how we see community level organizations contributing to community resilience. I think, again, it's really understanding what community resilience is, right? In the report, you'll see that we talk about personal or individual resilience is not equal. A number of individuals who are resilient within a community does not equal to community resilience. And what we are saying there is, if you find women in a community who are able to, harvest food at the end of a season, and they are able to feed their families, but at a community level, you don't have storage, for example, to store that food for times when there's famine within the community, and that community is not resilient. And so how do you ensure, as community level organizations, to contribute to community resilience? I think it's looking at each level, right? We talk about the socio-ecological perspective. So are the individuals within the community resilient? Are the families and peers and the interactions resilient? Is the community itself at that level, the structural level, resilient? So what you can do is to ensure that as you think about the interventions, you are looking at all these issues, right? You are looking at all these levels and ensuring that there's participation of youth. There is social norms are being checked, right? So that they are not detrimental and they are not discriminating against youth. And then there's that power dynamic between adult and youth. So as community level organizations, paying attention to all those and ensuring that at the personal level, which is at the individual level, mental health, self-confidence, contribution, all that. We'll talk about that in positive youth development. And then the enabling environments, right? So very helpful approach, if you really think about it, to look at the positive youth development approach. I think if community level organizations could adopt that, I think that would be helpful. Thank you.
Thank you so much, Gina. Any other responses in our final minute from the research team? Otherwise, I think we unfortunately will need to wrap up for time. So Nalini, just maybe to follow up as we conclude, the report that was referenced, after today's webinar, we were going to be finalizing the full report, the summary brief, and the practitioner guide that came out of this work stream. So those we expect to be finalized this April, and they will be shared out with everybody that attended today's meeting. You will also, in the next week, receive access to the recording and the slides that have been used for today's presentation as well. So you'll have those for your reference. And then we'll look forward to, again, sharing those out in our YP2LE Learning at Work with you all, and we encourage you to share it in your personal networks as well. Perhaps we can move on to the last slide. So just to note, we want to thank you all again for taking the time to join today's meeting. I want to give a special thanks to our presenters from the University of North Carolina, Chapel Hill, as well as from the International Center for Research on Women. And we look forward to seeing you all at future YP2LE events. So thank you all very much for your time. And please feel free to reach out if you have any follow-up questions after today's event. But again, we thank you for your time and for your participation in today's event.